Hello everyone. Today we're going to talk about AI and healthcare. Before that, a quick introduction. My name is Flix. I'm a general manager for the French market of Tandem. I'm here with Pierre. Pierre is in charge of expansions. And Tandem is a company, a European company that automate admin tasks for healthcare professionals. We've been born in Sweden, and we're expanding to Europe right now. Offices in Paris, London, and Spain, and we raised a seed of 10 million euros this summer. So, a brief introduction of who we are. So, from conversation to structured medical notes, how AI increase clinician productivity. We're going to talk about the most common use cases we have in healthcare, and the most admin, the admin task that takes the longest today for the clinician, the medical notes. A bit of context. I think all of us are aware of that. We are in a momentum and in a timing where healthcare is pressured by a lot of things. A higher volume of patients. People are living longer. We have got like a lot of chronic care and a lot of complex disease to take care about. We're asking a lot. We have the technology now to store data. We're asking a lot of data points to clinicians. And the healthcare system is in a pressured state because of many things, but we have a shortage of clinicians. That's the case in most of Europe. COVID emphasized a bit on burnout, on the life that was a bit complicated, professional life for clinicians. And in consequence, we have long waiting times. We can talk about that a bit later. I'll try to go a bit fast for the demo, so feel free to ask questions at the end. One big issue for healthcare is the admin. Admin takes a lot of time for clinicians. These are French data, but 90% of GP need to overwork to extend their hours to finish their admin task. We estimate roughly at 8 hours per week per clinician, the admin related to patients. And the last one is a bit sad, but a clinician throughout his career has one chance out of two to experience a burnout. We think that AI is a solution. I think AI is the solution for healthcare. We can see through what I'm going to show you just after that, a productivity boost. We can do the admin for the clinician. That's the most common use case we're working on. The idea is to help the clinician focus on the patient. That's what we have on the work environment. Do care, not admin. And the quality of care is increased as well because as of today, we have a lot of medical records that are incomplete. The idea with AI is to get more data and more accurate data on the patient journey. It's very simple. It works like that. You meet your patient when you're a healthcare professional as usual. The meeting is so Tandem is listening and transcribed in real time the meeting. And at the end, it generates pretty much all the clinical documentation you may need. We talked a lot about the medical notes because it takes a lot of time. But we can talk about the sick leave. We can talk about bon transport if you're working in a hospital. We can talk pretty much about any type of documentation you need to generate. And becomes your copilot, your medical assistant. We have like different names for that. The satisfaction comes from our data in the Nordics. We are working with 120 organizations, clinics and hospitals who are working with us. So we have a high satisfaction rate. And roughly right now we estimate that we diminish by 80% the time they spend on admin. We're going to switch to a quick demo. For the sake of the exercise, we're going to switch to French because maybe there are like a couple of healthcare professionals interested in working in French and doing this kind of demo. It's very simple. We're going to launch the web app and do a fake consultation with Pierre. I'm going to be the clinician and Pierre is going to be the patient.
Super.
Bonjour Pierre, comment je peux vous aider aujourd'hui?
Bonjour docteur. Écoutez, ça fait quelques jours que j'ai mal à la gorge, donc c'est assez enflammé, j'ai un peu de fièvre. Et dès que je mange, en fait, ça brûle énormément.
D'accord. Depuis combien de temps exactement?
Ça fait à peu près une semaine.
Ok, très bien. Est-ce que vous avez fait un test Covid, un test grippe?
Non, pas encore.
D'accord. Alors, on va prendre votre température. Effectivement, 39 de fièvre, c'est un peu élevé. On va prendre votre tension, puisque vous êtes là. 11,7. Bon, tout va bien là-dessus. Alors ce que je vous propose, c'est que je vais vous envoyer en pharmacie faire un test pour une angine bactérienne, vérifier que ce soit ça ou non. Et en fonction du résultat, vous prendrez, je vais vous prescrire des antibiotiques, ou alors vous allez juste prendre du Doliprane et attendre que ça passe.
Ok. Combien de Doliprane? Combien de grammes?
1 gramme par jour.
1 gramme par jour.
Ouais.
D'accord. Est-ce que je peux continuer à fumer ou...
Vous pouvez continuer à fumer, c'est pas recommandé. Dans l'absolu, moi je vous conseillerais plutôt d'arrêter. Maintenant c'est votre choix.
Ok, parfait. Merci
Super.
docteur.
Et vous revenez voir si le test est positif.
Ok, super. Merci beaucoup.
Merci. So beyond the second range, you'll have to trust me maybe. We stop the recording. We click on generating the medical note, and what's going to appear on the computer is a medical note on the structure that I'm asking, with basically the context of the consultation. Yeah, unfortunately, it's not here, so it's not that impressive. But we get pretty much all the information Pierre gave me right now, so I can read. Motif de consultation, mal de gorge, tabac, fume, état actuel, mal de gorge depuis environ une semaine, gorge inflammée, brûlure intense en mangeant, fièvre de 39 degrés. We get like objective data points that I get during the meeting. I took his temperature, 39 degrees. We get that here as well. And we get the next steps. What we talked about, mal de gorge depuis une semaine avec fièvre, c'est un constat. Et ce qu'on a mis ensemble comme plan, c'est je vais l'envoyer en pharmacie pour faire un test bactérien. En fonction du résultat, prescrire des antibiotiques et prendre du Doliprane. Voilà. Et il revient si le test est positif. That's very, very brief. I'm really sorry for the end. You cannot see it, but that's usually quite impressive. And there is an option as well at the end to transfer everything in your electronic medical record. That's quite painful for the healthcare professional in the room to fill in all these outdated software. The idea for us is to transfer it in one click, so your medical record is complete, and you can move on to the next patient. J'ai déjà fait. And pretty much it appears in the outdated medical record we're using. Everything we just talked about has been stored here, and on that point you really have to believe me. But I can show you after the demo if you're interested. Thanks a lot. Sorry about the demo effect, and if you have questions.
Hi, thank you. So first, how do you deal with data privacy, and where is the data from this transcription stored?
So the audio is not stored. The audio is suppressed immediately, and we just give you the medical note and the transcription if you want to review the transcription, and then we agree with the healthcare professional on the time where the audio is going to be conserved. The transcription is going to be conserved, and then we suppress it. So usually a month, a couple of months, depending on the organization we are working with, and then we suppress everything. And when it comes to data, we are, the data are stored in Europe on the HDS server, and maybe if you're like more specific question, we can take it just after the demo. Yeah. Maybe one last question. Yeah, sorry.
Yeah, thank you. Great project. Sometimes I talk to ChatGPT and it pretends to listen and then gives me like, I cannot connect to a server, try again. And this is going to be a lot of pain when you have only 10 minutes to get a patient. Yeah, so
to figure it out.
In your demo, there is no real-time feedback, like is it transcribing or not, right?
So it's a choice. The idea is some clinicians ask us, actually a very small part of them, to get the live transcript. Right now we don't provide that because we want the clinician to focus on that and not focus on the transcript. And then he can review it afterwards if it makes sense. Half of the notes we generate are untouched and sent to the medical record directly. So it means that we have a high level of completion and accuracy.
Okay. Makes sense.
Yeah.
Thank you.
Thanks a lot. Thanks.